I listen to almost every speed class, sir. Speed classes are wonderful, especially if someone is taking speed, they should completely finish all your videos, sir. I completely followed speed, sir. I finished Belly and Love, complete all the videos and bits. I just did it, sir.
I bring in all the wishes and greetings on behalf of Speed Medical Institute to Dr. Megha Shyam for scoring a topmost rank of 160 in MCA Surgical Group in NEET SS 2025 session. Congratulations to you.
Thank you very much, sir.
So great to have you in this session. I thank you for your valuable time to share with
It's my pleasure, sir.
and also to talk to our students also who are looking into this video. So
Yes, sir.
now can we get to know your brief background from where you started till date, what all you have accomplished?
Sir, my name is Dr. Megha Shyam. I am from Vijayanagaram, sir, in Andhra Pradesh. I did my UG from Siddhartha Medical College, sir. It's in Vijayawada, Andhra Pradesh. At that time, I got a rank of 1252. That's in MCET, sir. That time, my MCET used to happen. And after that, in during our internship, we had COVID. And I took a drop that year. The preparation was not up to the point. So I took a drop, prepared for my NEET SS from my home itself, and I got 11,108 rank, sir. Surgery was my only dream branch. I only wanted to do surgery. So I took my seat from Bundelkhand Medical College, sir. It's a government college from Madhya Pradesh. So that's my background, sir. And I finished my PG just 2 months before the exam, sir.
Fantastic. Great accomplishment. Wonderful accomplishments. Wonderful journey. Great. What is your super specialty?
Sir, gastro, sir. At 160, I'm getting gastro. So I'll be going into gastro, sir.
Why do you to take gastro? How you got an interest for gastro?
Sir, in our college, we used to get so much free hand, sir. So laparotomy, sir, every 3 days, once in 3 days, we had an emergency. So every 3 days, we used to do a laparotomy, either perforation, obstruction, any kind of thing. We had a lot of free hand. Our consultants made us do whole procedure on our own. They used to guide us, but we were the first surgeons. So by that, by doing each and every procedure, I think that love just grew up, sir. We didn't even have other super specialty branches in our college. So mostly we were all I was seeing was only gastro cases, abdomen cases. So I think that's how my love developed, sir. And I had my consultant, Dr. Love Gupta, sir. He did his FNB in Delhi in minimal invasive surgery. So sir used to promote me a lot. Matlab, he gave me confidence that you could do this, you could do this like that. So sir played a vital role in that. So I was not this confident, but sir really pushed me from my back. You can do anything you want. You start preparing for your super specialty. Even from my first year, sir used to say you should prepare for your super specialty from this point itself.
Great, wonderful. And
Yes.
congratulations and thanks to your professor who motivated you for making
Yes, sir.
regards to him.
Unit 1, sir. Unit 1, even my guide is from the same unit, sir. Unit 1. I will be forever thankful for them, sir. They pushed me a lot. Matlab, they told me that this, you cannot bound yourself, you can work harder. So they didn't even let me set my limit. They pushed me so much forward.
Very nice. Excellent. Great. Now, once you decided to do a super specialty and surgical gastro, I mean, what all you did to achieve this? What is preparation strategy? Can you share on that?
Sir, first 2 years were pretty busy, sir. Matlab, I used to get a little bit of time. I used to read articles and daily, sir. So it was in my third year during my DRP program where we get 3 months free time. I started studying from a Bailey and Love textbook. I started studying, sir. So once I finished one reading, then I know speed from my internship days, sir. In my UG days only, all my seniors used to study from speed. So I thought I will take speed and start my preparation quite seriously. So after the DRP completed in my third year, I had single junior for the entire last 6 months, sir. So uh, I taught him how to manage the ward. He used to give me 2 to 6 during OT day and free day. 2 to 6 was he used to give leave me. I used to come to room. I listened to your lectures, sir. So many classes, premium master class, Bailey and 28th, 21st edition Stavistan class, Swartz class. I completed all those classes in that time. 2 to 6 in evening. After 6 to 8 rounds, he used to manage the ward. His name is Dr. Arsh. I think I should mention him. From 6 to 8, I used to do ward work and then come back, and again 8 to 12. So like this, this period happened from April, May, June, and July, sir, till July. From August and September, my main exams were coming, MS exams. By that time, I completed 80% of the speeds videos, sir, and I was continuously revising my notes. I prepared my own notes, revising speeds notes and Bailey and Love. Speed and Bailey continuously. By the time I gave my theory exams, I think I have revised 5 to 10 times, sir.
Wow. Great. Amazing. Wonderful. Great hard work and perseverance. Excellent.
Yes, sir. Whatever little time I was getting, I used to do either bits, listen to lectures, revise. Uh, I think I just slept, worked, and just reading.
Great. Great. Doctor,
Yes,
how many
yes.
questions you attended in this exam?
In my exam, sir, I attempted a 141, sir. 9 questions, I wasn't completely sure. Matlab, after the exam, I thought, ki, "Arey, I should have attempted this, but I'm not gonna complain now, sir."
Okay. Good. Okay.
Yes,
Now, about the paper, what's your opinion about the paper?
paper was moderate, sir. Compared to the last time, I think the question framework was a little bit extra this year. Other than that, the questions were pretty easy, sir. I think I listened to almost every speed class, sir, in revision, premium master class, and 22nd edition Sabiston master class, and Bailey and Sabiston and Schwartz class. I completed all these. So whatever the question I saw in the exam, they were all already I have listened or I have solved. It was not much difficult, sir. I made some silly errors. That's why I got 160. If I had avoided those, I think I could have got a better rank. But I'm not complaining at this point.
Good, 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 good. You've done an enormous amount of hard work to complete all.
Yes, sir.
Enormous amount of
Yes,
hard.
sir. Sir, actually, after the yes, sir. After the exam, sir, I gave solid. We have 2 months for the exam, so I went to home straight away, and from morning 7 o'clock to night 12 o'clock, continuous bits. I completed all bits in speed app. A grand test finished, all topic wise bits finished, and if I had doubt, I rewatched some videos also, sir. I rewatched videos and I made my notes, sir, in a very proper way that if I would go back to the notes, I knew what I was missing and I used to cover it there itself. The way you taught in your classes, sir, initially making a skeleton, a little bit of anatomy, a little bit of embryology, physiology, then you divide it into the diseases, then each disease, what will you do? First, you make a framework. After the framework, we do bits. In the bits, we will add what is important for the each and every topic. So I like that. I really like that way of learning something, sir. And I think it is very easy if we study that way to attempt the MCQs. Even I came to my PG college now, sir. I'm telling my juniors how to study. This is how you will study. You will make a skeleton, then you add each and everything like that. I really liked your lecture, sir. I didn't even miss a class.
Thank you, Doctor. Thank you for, I congratulate you, appreciate you for the efforts and dedication you have made to attend all the classes, live sessions, recorded ones, everything. And that has worked for you. When it has worked for you and you are successful, I'm very happy for you.
Yes, sir. All I think there are some 20 to 25,000 bits in the app, sir. We should completely finish them. And the grand tests also, I finished every grand test, sir.
Very good, excellent, great. Doctor, what is your advice for the
Yes.
future of MCS surgical group?
To get MCH surgical group, sir, I think 80 to 90 bits we get easy bits, sir. I think most of the people will attempt them. In rest of the 60 bits, 40 bits will be 14 50 bits will be moderate difficulty, sir, and 10 bits they will be a little bit more difficult, sir. So the main scoring is this 50 bits, sir, which are moderately difficult. So to tackle them, I followed your classes, sir. I used to listen to your classes. Even I can recall one question, triangle of cock in the heart. Sir, I think that was it was in your one of your brainstorming sessions. Actually, we were discussing some other topic. You brought it towards triangle of cock. Otherwise, I wouldn't even have known it, sir. So at that point, I realized, yes, a triangle. Sir told me at that point, a tendon of Todaro, there will be node here. So we should be careful while operating. You just told us the operating scenario, sir, at that point of time. By that way, I remembered it back. So we should listen to classes. Speed classes are wonderful, sir. Especially if someone is taking speed, they should completely finish all your videos, sir. That's one. And number two, bits. There should be no compromise. If we do speeds bits, sir, with basic knowledge, then I think it's enough, sir. I don't think for surgical gastro you should need some bit of luck, and you should do a bit less mistakes. Other than that, if we completely follow speed, I completely followed speed, sir. You told us to read Bailey and Love. I finished Bailey and Love. You told us to complete all the videos and bits. I just did it, sir.
Good, great.
Yes, sir.
You did and you got it. That's the beauty of it. So, I mean, that's how, I mean, it's more about doing, and it's also about getting. And once you
Yes,
are successful, is nothing like that to us. Because
yes, sir.
we have as all faculties, we have achieved uh, what we wanted, like what MCH we wanted, what specialty we wanted. And we want our juniors to also achieve happily,
Yes,
and also smoothly, and also at the same time with adequate knowledge. So that the process they
yes,
get the adequate knowledge in preparing for the exam. So that is the very idea of doing this program. And this
yes,
program for you, I'm very, very happy and delighted for that.
yes, sir.
To thank, and whom all you want to thank, that you feel that the day one till date they have stood by you and have helped you and supported you, you can use the platform to do so.
Yes, sir. I would thank my parents, sir. My father just retired. He used to give me food and everything. I just used to get up and read, reach and everything. He used to take care. Then I would like to thank my consultant, sir, Dr. Lav Gupta, sir. As I already said, Dr. Lav Gupta, sir, Dr. Deepak Srivastava, sir, Dr. Akhilesh Ratnakar, sir. Deepak Srivastava, sir, was my guide. Ratnakar, sir, was my first professor, sir, that I've encountered in my college here. And rest of my faculty, Dr. Dushyant, sir, Omkar, sir, Dr. Jiten sir, Ashish Dubey sir. Thank you very much. And special shout out to Dr. Harsh Goyal. He was my junior, and I think without his help, I think I wouldn't have got that time to prepare all this.
Very good, very nice, excellent. I once again wish you all the very best and all the success for a great, amazing, and admirable, astonishing career in surgical gastroenterology. As a Megha
Yes,
Shyam,
sir.
make a landmark and make a mark and inspire
Yes,
me and others and thousands of surgeons like us, and always and
yes,
students, medical students, and wish you all the best and all the success. God bless you.
yes, sir. Thank you, sir.